Here are three things to consider when managing patients with postural orthostatic tachycardia syndrome, or POTS. First is that some patients with POTS may actually have an autoimmune disorder that is contributing to their symptoms. There's a growing body of evidence that suggests that many patients with POTS have autoantibodies against receptors of their autonomic nerves, specifically the alpha and beta adrenergic receptors. Whenever antibodies cause inflammation to these nerves, that could explain these POTS symptoms. Now, there's not a whole lot that is being done to address the autoimmune components for many of these patients, but research is ongoing and being investigated on potential therapies to address autoimmune conditions. And this can mean different drugs like steroids, it could mean autoimmune drugs like hydroxychloroquine, or it could even mean more severe types of therapies like IVIG for more severe manifestations of POTS. But this is something that is ongoing, but this is something that we may also find that patients with POTS may benefit from different dietary changes or even supplementation. Number two, some patients with POTS may benefit from a gluten-free diet. There's some low-level evidence that suggests that patients put on a gluten-free diet could have an improvement in some of their autonomic symptoms when they're on the diet for an extended amount of time. There's also some evidence that suggests that there's an overlap between celiac patients and POTS patients that is just starting to emerge. And again, this is another area that is just starting to be researched more thoroughly. But going on a gluten-free diet may be a safe, non-harmful way where you could experiment with it, and it may have some meaningful change on your POTS symptoms. Number three, a lot of patients with POTS have something called exercise intolerance. And what that means is these patients will do physical exercise and their symptoms will actually get substantially worse. And this introduces a problem because one of the best ways to address autonomic issues is to actually do physical exercise. But a patient with POTS, their metabolic capacity is such that any amount of exercise that crosses their threshold is going to make their symptoms of fatigue and some of their autonomic issues much, much worse. Now, this doesn't mean that we have to eliminate movement completely. It means that we have to give them a pathway towards being able to do actual exercise. Some of the ways that we might consider is changing the body position while doing exercise, meaning instead of doing exercises upright, we may have them doing exercise while they're laying down on their back or on their stomach. Instead of doing active exercise, we might just have someone move the person's body for them in order for them to build capacity for the sensory stimulation that's associated with the exercise. Depending on the severity or condition, living with POTS can be extraordinarily difficult and sometimes disabling, but for many patients, there is a pathway towards alleviating the symptoms, and for some patients, remission may be possible.